This presentation is on aphasia by Ayaka Saito. Aphasia affects lesion of the language center. It is an acquired disorder of language. It is an ineffective or inefficient language use in natural communication context. Aphasia is not a perceptual problem such as hearing loss. It is not a disturbance of thought processes such as schizophrenia and dementia. It is not a motoric problem. It does not necessarily involve general cognitive impairment. There are confusion in three terms. Dysphagia with the letter S means disturbance in language and a medical clinical label. Dysphagia with the letter G is a swallowing disorder. Speech-language pathologists typically prefer using terms aphasia and dysphagia with the letter G in order to avoid a confusion. Primary causes of aphasia is listed below. However, cerebrovascular accident are the major etiology for aphasia. Stroke results the blockage or rupture of blood vessels in the brain. Loss of blood to the brain leads to the brain cell death or damage in the areas that control language. The primary characteristics of aphasia is language impairment. The onset is usually sudden, and aphasia usually affects both language expression and reception, though in most cases one component will be affected more severely than the other. Anomia, difficulty recalling names, is generally present in all of the aphasias. Brazilian language arc is a significant area. It is a horseshoe-shaped area that surrounds the sylvian fissure in the temporal and the frontal lobes. It perceives and integrates language with other cerebral activities and articulates expression. Broca's area is a motor speech center, and Wernicke's area functions in comprehension and formulation of language. Articulate fasciculus is the bridge from the Wernicke's area to the Broca's area. There are several classifications of aphasia. Types of aphasia can be divided into non-fluent and fluent. Non-fluent aphasia is characterized by a language disturbance with disrupted non-fluent output. Broca's area and the frontal lobe are the lesion. Global aphasia, Broca's aphasia, transcortical aphasia, and a mixed non-fluent aphasia are the type of non-fluent aphasia. Fluent aphasia is characterized by a language disturbance with a relatively fluent speech output, temporoparietal region, in and around Wernicke's area in the temporal lobe, and possible damage to surrounded areas in the parietal lobe are seen. Here's a useful classification table regarding fluency, auditory comprehension, repetition, and naming. This is an algorithm for diagnosis of 8 classical cortical aphasia. The following are the list of references I have used. I hope you enjoyed learning about aphasia. Thank you so much for watching.